This is our patient waiting room. Hello, everybody.
Hello.
Is everybody behaving?
Yes.
As you come in, you will get clerked, and this is our intake area. Our ladies are currently doing some filing. Hello, everybody. That's Lisette, and that's Amy, and that's our HIPAA-compliant medical records department, where we keep our color-coded records. Let's say you come in here with severe pain, or you've had a stroke, or you have MS, fibromyalgia. This is where you will come in and get a history taken, and then you'll come to one of our examining rooms where I will examine you. And this is where the initial examination is done, where we try to understand from a clinical perspective the patient's history and complaints. Sometimes the patient will sit down at this conference table, which is a little bit messy, where we will go through all the old medical records. Sometimes patients come to me with voluminous medical records, 6 inches thick. Hello. The patient will undergo an EEG, and you can see the actual EEG being recorded over there. And that's Trish. And this is Dennis. Good morning. Good morning. You're on camera.
Oh, am I?
Yes.
Cool.
And Dennis, say hello.
Hello.
Dennis is our electrophysiological registered technician who does the electrical studies, as you will see. How are you doing today? Good, good. And this is the radiology suite where our CT scanning is done, both mainly heads and spines, to give us an imaging picture of the spine to correlate it with the electrodiagnostic findings. Very often patients come to me having had surgery on their back, and they're in terrible pain post-operatively or 3 or 4 years after surgery. So sometimes we are looking for complications and arachnoiditis, which requires the injection of dye for a CT and a myelogram, and that would be done here. Once the diagnosis is made, we then institute the treatment therapy, and being a pain management specialist, we're interested in an integrated approach that combines both medication, anti-inflammatories, anti-pain medication, as well as therapy, which includes the kind of therapies that you would get in a hospital, but more pain therapy rather than rehabilitation therapy. So that would be done with Cece, our therapist. Hello. And we do deep tissue massage for patients with RSD and for chronic fibromyalgia, and electrical stimulation as well as ultrasounds. If that fails, that is, if the medication and the therapy fails, or you've come to this clinic already having gone through all that, then the next step would be to try and understand if we could be of help through pain management intervention like injection work. And that's done in our fluoroscopy suite. This is a clean room, and this is where we do our epidurals, our nerve blocks under anesthesia, where we do our implants for dorsal column stimulator and our implants for morphine pumps. So it's all very compact down here in Rensselaer, halfway between Merrillville and Lafayette in Indiana, about an hour and a half from Greater Chicago.